very good afternoon, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about management of melasma and hypopigmentation from an expert. So let's connect today with our skin expert, Dr. Nazia Nousheen Siddhique, joining us from Hyderabad to make us aware on treatment on management of melasma and hyperpigmentation. Dr. Nazia is a dermatologist and trichologist in Malakpet, Hyderabad, and has an experience of 17 years in these fields. Dr. Nazia practices at Skin and Hair Clinic in Malakpet, Hyderabad. She completed MBBS from Gandhi Medical College, Hyderabad in 2005 and DDVL from Gandhi Medical College, Hyderabad in 2007. She is a member of Indian Association of Dermatologists, Venerologists, and Leprologists, IADVL, member of International Hair Research Society, and member of Association of Cutaneous Surgeons of India. Some of the services provided by the doctor are thicker eyelashes, scar treatment, acne, pimples treatment, hair regrowth and baldness treatment, etc. Today, doctor will share with us on treatment on management of melasma. A very good afternoon to you, Dr. Nazia, and a very warm welcome. It's a pleasure to have you here.
Thank you so much. Very warm greeting from you and your kind words of introduction. I'm so happy to join you on this melasma awareness discussion, what we are going to have today.
Definitely. It's a pleasure, ma'am. Really looking forward to this session. And as today we are going to talk about melasma and its management, let's begin with what is melasma? How did we know, what is melasma?
Yeah. It's a very common, a very important diagnosis we see day in and day out during our practice. Melasma is a condition in which the person develops pigmented patches on the cheeks or nose or forehead. It comes sometimes on the upper lips as well. It's basically a brownish pigmentation which appears on the more in fair skin individuals. Actually, there are different types of melasma depending on the site of involvement, like melar type and nose melasma, and also depending on the depth of the pigmentation, like epidermal melasma, dermal melasma, and mixed varieties of pigmentations. And when we see the patient of melasma, all of them just look the same. But when we clearly examine them with the help of a Woods lamp or with the help of a dermoscope, we come to know that they have a dermal melasma or only epidermal variety of melasma. So that is, melasma is basically a pigmentation on the face which is caused by sun exposure.
Right, so it's basically pigmentation on the face, and there are a lot of variety and patterns of melasma. Now, doctor, we would also like to know about the causes that are responsible for causing melasma.
Yes, melasma is caused by several factors. Mostly during pregnancy, patient is exposed to so many hormone changes in their body. There's a lot of melanocyte stimulating hormones secreted in the body, and they become prone to getting these patches of melasma on their faces. Most of the time, the first incidence of melasma happens during pregnancy because they are more photosensitive during that period, and that is particularly called cloasma. Otherwise, other than this cloasma, patients also develop melasma because of their lifestyle. They have a lot of sun exposure, and like people working outside or on the field, like field workers, or sometimes in the building construction works, males, and who travel a lot, have a lot of tendency of getting melasma. And we also see patients who are exposed to more of this straight lights, of infrared lights also. Even though they stay indoor, they also get this incidence of melasma. And oral contraceptive pills and certain medications also make the patients prone to get this melasma. Sometimes certain chemicals like certain creams or some cosmetics also make them prone to get this melasma and pigmentations.
Right. So these are the various causes. So along with the hormonal changes, especially during pregnancy or other reasons, sun exposure or exposure to the other harmful rays are also one of the important causes of melasma. I would also like to know, doctor, there are two terms, A, melasma, B, hyperpigmentation. Are they the same or are they different?
Pigmentation, hyperpigmentation is a broad term. It is any pigment which can be deposited anywhere on the body. It's not just melasma. Melasma has a certain brownish tinge and it is well demarcated, whereas pigmentation is the mark which can be left by any inflammation, like any injury. Like some people have pimples on their faces, and when the pimples heal, during that healing phase, they leave marks at the site of the pimples. They are called post-inflammatory hyperpigmentation marks. Like if somebody has a injury on the leg or anywhere in the body, that also leaves a mark which is darker in color. That is called pigmentation. Pigmentation is a term which can cause pigment anywhere in the body, and it doesn't have this brownish tinge, and it does not have the site predilection like melasma, which has site predilection more on the face. It can be anywhere.
Right. So hyperpigmentation is a broader concept, has broader definition. I would also like to know about, I mean, you have already spoken about it, the symptoms and signs of melasma, but still to our viewers so that they can understand that whatever is forming on their face or neck, it's something to do with melasma and they can go and consult your dermatologist. What are the symptoms and signs of melasma?
Melasma usually, as we see more of the melasma in fair-skinned individuals. These fair-skinned individuals, they have a tendency to tan faster. I mean, they have an erythema tendency faster. They are sunburned easily. So such people get pigmentation spots, freckles, all these things on their faces faster. So the first symptoms can be on the nose or cheek. It starts as a small patch of pigmentation, brownish colored patch. Then because of the continuous and like it is a cumulative effect of the sun exposure, which happens during a course of time. It is not an overnight procedure that happens. And after a cumulative sun exposure for a long time, for a certain amount of time, they get pigmented spots and patches on their faces. So definitely the first symptom will be a pigmented spot on their nose or cheeks or forehead or upper lip or chin sometimes also.
Right. So these are the areas where, if we see freckles, etc., we should go and consult a skin expert. Doctor, what are the risk factors for melasma?
The most important risk factor for melasma is sun exposure. I see a lot of population in which the melasma is common is the population who spend a lot of time in sun. Like we see sometimes agricultural people or sometimes some engineers or some site engineers and these people who travel. So first prediction is photo protection only. The more the amount of sun exposure, the more the chance of getting melasma. Some people travel a lot for their work, even though they are affluent works and professionals. Due to their travel work, they tend to get melasma. So sometimes even people who travel in the cars with all windows, because the glasses they are not having UVB and UVA protection, they can get melasma, and we see more amount of pigmentation on the side which they are exposed to the sun. Like if somebody is driving, they get more pigmentation on the right side. So much can be the proportion increase in pigmentation because of sun exposure.
Okay, and how do you, as a skin expert, diagnose melasma?
Yeah. As a dermatologist, it's the diagnosis of inspection. As we see, we can easily diagnose melasma, but still, if we have any doubt regarding the etiology of pigmentation, we have to go for certain investigations. The one investigation is a Woods lamp. Woods lamp is a narrow band UVB light at a certain nanometers length. It is a handheld device, and under the Woods lamp, a blue light will come. With exposing the patient's face under the blue light, we tend to check the pigmentation, how the pigmentation is different. It is brownish or dark brown. so we can know which type of pigmentation it is. And one more important diagnostic tool for dermatologists is dermoscopy. Dermoscopy is an instrument, it's a handheld device. We have to put on the face and check the depth of the pigmentation and extent of the pigmentation. We can know the patient has melasma or any other pigmentation things.
Right. It's an age-old phrase that prevention is always better than cure. Uh, can we prevent melasma? And if yes, how do we do that?
Certainly. This is a very important message I would like to give to the people who are watching this, that prevention is always better than cure, because melasma is very tough. It's a challenging treatment, and the treatment doesn't end with the treatment program what we have, because they have to take care. So it's always important to think about and prevention of these things. Like we see sunscreen, application of sunscreen is the most important thing. Not just the sunscreen, people should start, their lifestyle should modify according to the sun exposure. They should start wearing either hats or some scarves so that they can protect themselves from the UV exposures. And it can be because of with cloth, with hats, and under shade. They can start using umbrellas and traveling less in the direct sun. Like that is also important. We should decrease our exposure time to the sun, and this also prevents the incidence of pigmentation. And last not the least, the usage of sunscreen. We should know the proper usage of sunscreen, when to apply, how to apply, and what's the importance of using a sunscreen, so that we can prevent melasma. Like I would say, people who start using sunscreens in the early ages, hopefully they will not see these pigmentation problems even during their late ages. So they'll be thankful to the doctor who has advised if they start using sunscreen during their early ages.
So the earlier we start using sunscreen, the better we are prevented with melasma. Doctor, one more thing, as you have mentioned initially, that along with the sun exposure, even if we are inside indoors, the other rays from various sources like the laptop screen, mobile screen, etc., they are equally harmful. Does those sunscreen put some protection from those lights as well?
Yes. The exposure from this laptops or our devices and all, they are called blue lights. Nowadays, some glasses are coming, and certain Android phones. I have seen certain Android phones, they are coming with blue light filters also to prevent the damage caused by blue light. And also the sunscreen also have ingredients. The physical sunscreens what we use definitely protect us from this exposure what we get from the blue light. And not just the blue light, even doctors and surgeons who are, because they work under the operation theater, and they have a lot of sun light from the focus on their heads, that lights also can cause melasma. So they have to protect. I mean, for certain people, I have seen surgeons who get pigmentation in certain areas of the face because of the lot of exposed in the OT, operation theater.
Okay, so even those lights that we have at OT or other places can be harmful for our skin. Now, doctor, as you have mentioned that sunscreen is important, it can prevent our skin from melasma. Can you please elaborate a bit on sunscreen and the usage and how to apply, how often to apply, etc.?
Yes. Yes, all of us should have a important knowledge about how to choose a sunscreen and when to apply that. See, basically sunscreens, they are of broadly two types. They can be a chemical sunscreen and a physical sunscreen. And when it comes to chemical sunscreens, we had certain chemicals available in them like avobenzone, oxybenzone, and there's a list of products which are present in these chemical sunscreens. I can enumerate, and when we have to check for these ingredients. So light, with the spectrum of the light, when we see, it has different types of light in that according to the wavelengths of sun exposure. There is infrared light, UV light. And UV light, there are different types, UVA light and UVB light. In UVA, again, we have UVA1 and A2. And this is all depending on the nanometers. I mean, the wavelength of the sunlight, what we are being exposed to. So when we see a sunscreen, always see for how much SPF is present in the sunscreen. This SPF basically is sun protection factor. The sun protection factor is the thing which can help us not to burn. If a certain individual has a tendency to burn in 5 minutes after sun exposure, and if he is applying a sunscreen which has 20 SPF, 5 into 20, even after 100 minutes, you will not burn. So SPF, the sun protection factor, is the thing which will protect him number of times. Even if he is exposed to sun, he will not have burn or erythema. That's the thing. That's called sun protection factor. And sun protection factor is basically the thing which is helping us to prevent from UVB rays, UVB. But whereas the more complicated thing what we get from the sun exposure is the pigmentation, and pigmentation which is usually comes from UVA light. UVA light has a longer wavelength, and sun protection factor only will not protect from this UVA light. We need to have PA factor. We have to check for the UVA protection. So every sunscreen will mention the PA. PA rating means A protection, UVA protection. They will give PA plus or PA2 plus and PA3 plus. The sunscreens which mention PA3 plus, which have a good protection against the UVA radiation. So basically we have to see for two important things. One is SPF and one is PA rating. And one more thing is boot star rating. This boot star rating is also given in certain sunscreens which basically comes from United Kingdom, UK guidelines. This boot star rating will give 1 star, 2 star, 3 star, and 4 star, and sometimes 5 stars also. This 4 star boot star rating gives lot of UVA protection. So we have to see for this not just SPF, we should also see for this PA protection factor and boot star rating to have proper UVA protection for us, because when we are talking about melasma, we are talking more about a UVA component, which is more harmful for us not to get this pigmentation. And again, one more thing I will tell is water resistant sunscreens. We need sunscreen basically when we are going in a lot of sun, but when we go to the sun, we have the tendency to sweat. If the sunscreen is not able to resist the sweating, and sometimes people apply sunscreen before going in water, like swimming and all, and once it is not having this water resistant condition, it is difficult for us to have a lot of sun protection. So we also have to see the water resistant label on the sunscreen, and all the sunscreens are supposed to mention this mark, water resistant, and also they have to mention for how much amount of time that the sunscreen is resistant to water. And they will mention about like 30 minutes or 40 minutes or 80 minutes maximum, a sunscreen will be water resistant. After that, we have to reapply the sunscreen. I think we have a question popping up.
Yes, there are too many questions. I'll pick them one by one. Ishan Jha is there asking, is melasma hereditary disease? Anything to do with genetic?
Definitely, there's a genetic preponderance for melasma because it is present in, like the skin is genetic, melasma also, the tendency to get this pigmentation is also genetic. And so there is a genetic mechanism, but more of the lifestyle and sun exposure.
Okay. We have another question. What best foods to eat if we have melasma? Any food that will actually protect us?
Yes, very good question. See, the problem what is happening is pigmentation. This pigmentation, melasma, and all these things happen because of oxidative stress. So we can consume during consumption and during the treatment of melasma, the importance of antioxidants is more, because this antioxidants as such will decrease the oxidative stress which is happening and which is causing the pigmentation. So I would say vitamin A, vitamin E, vitamin C, carotenoids, all these things are called antioxidants. And when it comes to food like carotene containing foods, vitamin A containing foods, and fresh green vegetables and colored vegetables, they have a lot of antioxidants, and such consumption of antioxidants definitely helps us to fight the sunlight better.
Right. So eat healthy. That's really important. Include a lot of fresh seasonal fruits and vegetables in your regular daily meal. Before I pick some of our viewers' question, one more thing I would like to know about melasma is the treatment options available. What are the treatment options available for melasma?
Yes, there are so many treatment options available, but we are not sure that we cannot say that the melasma is not going to come back after any treatments. So the maintenance to prevent the melasma continues to be important even after the treatment has been done. So I would say, according to the how we follow the protocol, how to protect the patient and how to treat the patient, definitely the patient should start using sunscreen whenever he starts. And when it comes to depigmenting creams, I mean the melasma decreasing pigmentation, the important treatment what I usually follow is the Kligman's regimen. Kligman's regimen is a combination of so many products in which we have tretinoin and fluocinolone and hydroquinone. This is an important tool against melasma. But not all individuals will be able to tolerate the treatment regimen, because when there is a usage of tretinoin and also hydroquinone, sometimes people get a lot of irritants. Then we make use of other products which are available to decrease the pigmentation, like arbutin, it will be licorice, and vitamin C, and glutathione topically, and topically tranexamic acid. All these medications are available for the treatment of melasma. And depending on the patient, his lifestyle, and how he's able to tolerate, we have to decide what to start on the patient. And like how chronic is the melasma? Sometimes patient is a naive patient. He comes with a fresh spot of melasma. For us, the patient is easy to treat. But sometimes the patients walk in with a chronic melasma, which has been treated for a long time, and again it is going to come back and come back. Such patients, we have to be very careful. They're very recurrent melasma patients, tough melasma patients. That is difficult for us to treat also.
Okay, so treatments are there. A lot of treatments are there. What we need to do is go and seek the advice of a dermatologist as soon as we spot any spot, freckles, etc., or signs and symptoms of melasma. Please go and consult your dermatologist. Don't just wait that it will just go away on its own, or we'll do some home remedies and it will be good for us. It can actually make the condition worse. So please don't waste your time. I'll take one more question of our viewer. Advik Singh is here asking, can melasma turn into cancer?
No, I think he's asking a very important question.
Yes.
No, melasma actually doesn't, we have very less reports of melasma changing into cancer. See, the importance of usage of sunscreen is not just to prevent melasma, but it is important to prevent malignancies as well. Not in India, but Indian skin has some melanin. We come under type 4 and type 5 of the skin. It means that we have some melanin in our skin. We are colored people. Whereas when it comes to the other part, like people of fair skin, their skins come under type 1, 2, and 3. Such people do not have melanin in their skin. Such people, like who don't have melanin, fair skin, blonde, colored, white people, they are more prone to get malignancies. For them, it is very important to have sun protection. Indian skin, because as such melanin is a pigment which is giving us sun protection. Melanin is actually protecting our dermis and other skin components from this harmful radiation which can cause malignancies like melanoma, squamous cell carcinoma, and non-melanoma skin cancers. But melasma, as the question comes here, melasma as such cannot turn into malignancy.
Okay, so that's news that can actually, we can have some relief. Melasma normally doesn't cause cancer or turns into cancer. We have Abhishek Sen asking, who is most prone to melasma?
Fair skinned individuals are more prone to melasma. Like in Indians, it will be type 4, and skin, they are more prone to melasma. And people who are a lot of exposure to sun, they are more prone for melasma. And again, I said it before, people who are pregnant, women who are pregnant, and people, girls, ladies who are taking oral contraceptive pills also are prone for melasma.
Okay. I'll pick few more questions. Nimo Ramesh Upadhyay is asking, is melasma very easy to treat?
It's actually, this is a very important, critical question is asked. Melasma is definitely easy to treat, but to continue the remission, the patient doesn't getting back the pigmentation is a very important thing. It needs a lot of counseling and from the doctor's part, and the patient also should have a lot of motivation to apply the sunscreen every day and take his antioxidant. And many of the times the melasma tends to come back when the patient is not being careful with the sun exposure, and if is not taking care of the skin as required. Otherwise, it is easy to treat melasma.
Okay, and Priyanshi Dubey is asking a similar question on the same lines. Can melasma be permanently cured?
Melasma, I've been telling it again and again that melasma is a tendency to pigment. Right. See, when our skin has so many cells, and that one of the cells are melanocytes. These melanocytes have got a tendency now, because of the sun exposure, some oxidative stress has happened in them, and they have started producing a lot of pigment. That pigment is nothing but melanin. And once these melanocytes have got this habit of making pigment, it is very difficult to control them. Once they get the stimulus, they start making the pigment again. So, and we cannot kill these melanocytes. Killing the melanocytes is equal to creating a white patch that nobody wants. We can tolerate a black patch, but we never tolerate a white patch on the face. So we just have to control the kids. These are the children in the classroom. We have to discipline to make less pigment. The amount of pigment, how much it is required for us. That's only we are trying to depigment in that. We are not trying to kill the melanocytes, or we are not trying to stop the pigmentation totally. So likewise, the treatment goes, and according, if the patient is able to follow the particular things, what the sunscreens and moisturizing creams and proper peelings and antioxidants, definitely it can be continued remission. I have seen many patients, they came totally out of remission. Sometimes, it happens when the lifestyle of the patient changes, melasma comes into control, and a lot of sometimes we see this such as patients, and certain patients, they change their diet to vegan, and I have seen one or two patients who changed their diet and they started using a lot of greens and all. They had a lot of improvement in their melasma. So there is definitely a role of antioxidants in the pigmentation.
So healthy lifestyle is important. You need to trust your dermatologist. You need to complete the whole course. Just, don't distrust your doctor, because they will exactly know what your problem is, how they can treat it. So please don't ignore whatever symptoms and signs you are seeing on your skin. Let's take a few more questions. Palak Sinha is asking, doctor, what are the side effects of treatment of melasma? Any side effects?
Yes, this is also an important question nowadays. In our setup, so many people, they will not consult a doctor and they will buy the cream directly from the pharmacy. Right. And many of the times, the creams what they take, they have strong ingredients, like for example hydroquinone, and sometimes mometasone. They keep on using. We see patients like they have been using fairness cream. Just even they don't have melasma, but they want a fairer skin. So they start applying these depigmenting creams and they become fair. But they do not realize that these depigmenting creams have very stronger ingredients like mometasone and hydroquinone, which are not good for their skin for a long-term usage. They have a certain amount of time they have to see and they have to use it. And after a certain amount of time, they start seeing the side effects. It can be the skin becomes thin and they can see the blood vessels on the face. And sometimes people start seeing extra facial hair increasing. And one more important complication is ochronosis. Because of continuous chronic exposure of hydroquinone, they get a different type of pigmentation called ochronosis. That is also a side effect of using this depigmenting creams. So always you should consult a person to know what to use, and they should not start using whatever creams are available over the counter and take their own medications.
Actually, I mean, that's more important. Please don't go for self-medication. Don't go for what the chemist is, telling you, or don't go for over-the-counter medicines. That can actually worsen the condition. So it's better, as we are continuously saying, as soon as you spot anything, any signs, any symptoms, please go and consult your dermatologist before it gets too late, because for them also, it will become a little easy to treat you then. So
yes,
please,
yes, you are right.
Don't ignore your signs.
Yes.
We have Shah Nadeem asking, how can we differentiate melasma from pigmentary demarcation lines? Though we have already, talked about it, but still, if you want to throw some light on it.
Asking about pigmentary demarcation lines. So this pigmentary demarcation lines, the site of this appearance of pigmentary demarcation lines is different. They usually appear around the eyes, just like this, around the eyes. You must have seen in patients who are getting the pigmentary demarcation lines, they are having a linear demarcation over something like a Batman sign. These pigmentary demarcation lines are genetic, like they have in families. Sometimes people who have their parents having these demarcation lines, they getting this PDL. They are called PDLs. They are not melasma, they are called PDLs. And these PDLs are tough to treat. Melasma as such at least responds to the depigmenting creams what you're applying, but PDLs are very tough to treat because there's definitely an evidence of genetic evidence for this appearance of lines. And also weight gain also has a role in this appearance of PDLs. And more of the times this PDL needs treatment with lasers and other procedures to get it off. And still nobody can assure that you can get rid of these PDLs because they are genetic. They have you have inherited this.
Right. And in this case, doctor, for example, one of my parents suffer from melasma, say, and of course I didn't have the risk of having melasma as well. Now, what can I do? I mean, should I start early or seek an advice from a dermatologist early of my age?
Yeah. Early for the age, definitely everybody should start sun protection, and people who have a family history of melasma should be careful with their skin to apply sunscreen regularly and adequately. And also they can take a good diet, have a healthy diet, should include that one. And antioxidant, I don't say it is needed for everybody, but if at all you are feeling that your skin is dehydrating and you have a lot of stress, it's better to use some antioxidant for at least for a short time, like 3 months and all. They can take antioxidant medicines like vitamins, and you should be protect. The important this thing for sun protection is most important.
So we need to protect our skin from sun or other harmful rays. We need to have a really healthy diet full of fresh and leafy vegetables and fruits. And in case we see or spot any sign of melasma or hyperpigmentation, we need to go and take the advice of our dermatologist. We have Shubham Maran asking us, can melasma be due to some allergy or infection?
No, it cannot be because of some allergy or infection. It is more of like post-inflammatory hyperpigmentation, like we said, hyperpigmentation or PIH. They can come because of eczemas and allergies and all, but not melasma.
Okay. Ankur Deshmukh and A. Raju, they are asking almost same questions, so I'm clubbing their questions. What vitamin is good for melasma, and does vitamin C help with the melasma?
Yes. Vitamin A, C, E, all these vitamins are good for melasma, and also carotenoids are good for melasma. Vitamin C definitely helps. Vitamin C decreases this pigmentation forming things, decreases formation of melanin. So vitamin C definitely, the consumption of vitamin C is helpful in decreasing melasma and also to prevention of melasma.
So you said the consumption of vitamin C and other, vitamins that you mentioned is good for a healthy skin. But then people also use a lot of vitamin C serums, vitamin C, based creams, etc. Are they equally good?
Yeah, actually, vitamin C is very sensitive. It cannot tolerate the usage. When we cannot have an active form of vitamin C in topical things, and it usually degrades. It forms into L-ascorbic acid and D-ascorbic acid. So the vitamin C being active is very difficult to the shelf life and all to promote. So that is the thing. It is difficult for us to get the topical vitamin C, and which is actually helpful for the skin to help this pigmentation. Otherwise, vitamin C is good. Definitely, vitamin C is good for topical application as well.
Okay. We have Parul Shinde asking, I have melasma on face and dark foldable patches around my neck. Please suggest some remedies to cure this.
So you have pigmentation around the neck and what is it? And
on face. I have melasma on face and some patches around my neck.
So when he's saying about the patches on the neck, I don't think he has melasma, because melasma doesn't come on the neck. I think, I mean, I have not seen the patient, I have to examine, but still, I think that it must be some acanthosis nigricans. Acanthosis nigricans is also a very important cause of pigmentation in adult population whose BMI is more and all. They usually get pigmentation around foreheads and here and the cheeks around the mouth and more on the neck pigmentation. It becomes velvety and black. That is called acanthosis nigricans. People who have acanthosis nigricans should definitely see a physician. They should see their BMI, and also they should see their fasting insulin, fasting blood sugar. And they should have a total checkup. And if needed, they have to go for certain oral medications also to get rid of this. And definitely topical medications like retinoids help, sunscreens help, and certain peels are also there which are helpful in this treatment of this neck pigmentation and acanthosis nigricans.
Right. So Parul can go and seek help of a doctor, right? She should go and meet her doctor as soon as possible. So Parul, please do that. We have Shivani Singh asking, ma'am, can melasma be caused by stress?
So stress is very important. Stress is something more related to oxidation. Stress causes so many things in the body. Stress causes increase in amount of steroid secretion in the body. Stress causes increased consumption of food. So stress causes so many diseases, and definitely skin gets bad with stress. And melasma, I don't find a direct pathogenesis, But definitely the skin also will degrade because of stress. A lot of oxidation takes place. People start getting wrinkles and their skin gets dried up and all these things. But melasma, as such, the stress has no. I have not found papers on this.
Right. And Nemo Ramesh Upadhyay has asked one more question. As you have mentioned, antioxidant, he is asking, it's humble request, kindly share actual action of antioxidants.
Yeah, I just now told about this antioxidant like vitamin A, vitamin C, vitamin E, and glutathione. Glutathione is a master antioxidant, and astaxanthin and other antioxidants, which are vitamin carotenoids. All these things, decrease the oxidative stress. What is happening in the skin? Oxidative stress, what it causes? It causes the release of a reactive oxygen species. This reactive oxygen species causes the melanocytes to increase in this production of melanin and also collagen degradation. So when we consume this antioxidants like important A, E, and C, definitely the reactive oxygen species which are released in the body are decreased. So this melanin production can be controlled.
Okay, so that's the whole, theory behind antioxidants. Doctor, one more thing. What happens whenever we see some freckles or, spots on our face? We'll wait and see whether it, fades away by its own or not. B, will try some home remedies. C, will, in worst case, we'll just go till the chemist shop and ask the chemist, wale bhaiya, please suggest some cream or, over the counter, whatever we get. That's what normally people do, which is very dangerous. That's what we are continuously saying. Now, when you see patients who have already wasted so much of time doing these things and not actually coming to a dermatologist, what's your reaction and how bad that case, is to treat?
Actually, I feel very sorry for the state because first of thing, okay, if somebody is waiting for that, it's a whole personal decision that they want to wait for the freckles to come down. And sometimes when they are not going out in the sun, sometimes they get the tan goes off. Like normally, all the tans don't require to treat it. Sometimes a simple moisturizer application and a sunscreen application also take care of the tan and pigment cells. And but the more harmful thing what they do is go and take any medicine from the chemist and start applying from the beginning, they might see that the spots have faded and all because definitely they're using hydroquinone. Definitely yes. But and I've seen patients, they start using this hydroquinone creams, but they do not apply sunscreen. That is actually harmful. It causes more of erythema, redness. And once you're applying hydroquinone and retinoid to the face at night, and when they are not using proper sun protection, the skin gets more burned, erythema, red. They look like red tomatoes. I mean, because of the usage of such night depigmenting creams. The third policy, what they adapt, is very harmful actually for them, and it creates bad patients. It creates tough patients to treat. For such patient to treat and handle, also it takes a lot of an enormous amount of mental work to counsel the patient, explain the usages, and explain the importance and what the damage already they have done to the skin. So first thing, sunscreen usage should be told. I think even in schools they should tell about the usage of sunscreens. The people should start using sunscreens early. I mean, it's not just because for a good skin. We are not Americans, or we are not that skin that we'll get malignancy and all. But it's sunscreen. If they want a good skin, if they don't want this pigmentations and all, they should start using. And this teenage girls and boys, they get pigmentation. I mean, when they get acne, they start picking the acne. They start picking. For that also, they get a lot of marks. That's also not a good thing. They should be counseled not to do that because they don't know. Children, they don't know what to do and what not to do. That all these things they should be told about their parents or teachers or more down all this. And that important person who will take care of the skin. Even see, dermatologists also are being updated every day. We are seeing new diseases like all we have seen during the last years was the new diseases like COVID or this anything. So even melasma treatments is getting updated. We have guidelines being released every year. We have new treatment protocols and new things coming up, new molecules being discovered. So everything is changing day by day. So, and who are getting the information, what is being changed are the dermatologists. So it's better to consult a dermatologist.
Fair enough. Very well said. And yeah, it's also important that we start with our children, we start with our, teens, kids, etc. Because if they start early with sunscreen, at least they'll protect their skin well. So it's important to educate them about the importance of sunscreen in their daily skincare routine. We have a few more questions. We have Shalu Sen asking, is aloe vera good for melasma? Because people love using aloe vera gel at their home. Is it going to be good for melasma, treating melasma?
Yeah, aloe vera. So many people do this one, like aloe vera. Aloe vera is basically what? It is a plant ingredient. It has antioxidant and it's a herb. And if you are somebody is taking that, consuming aloe vera and application, but as such raw aloe vera application, I will not recommend, because
Okay.
aloe vera has so many medicinal ingredients, but it has to be formulated. It has to be used according to the mixing into oily base and all. Like if they are directly applying aloe vera on the face, it can actually cause the dryness. It will take out the water from your face and it gets chapped and dry. So raw aloe vera, I definitely do not recommend that, and somebody should apply on their faces. And if at all they are having this knowledge to how to apply with mixture, and that only when we are including this aloe vera content in certain moisturizing creams, it has some medicinal benefits, like we all know, but not directly to be applied on the faces.
Right. And doctor, as we are, at the conclusion part of this session, any important message that you would like to share with our viewers?
I would like to share that we should know, all of us should know the importance of using sunscreens and the importance of the SPF and PA protections, and how to apply and when to apply the sunscreens, and also to take care of the skin with the help of moisturizer. These two important things are very important. One is sunscreen and one is moisturizing creams. And decrease the usage of this OTC, what they're available in the market, like fairness creams and strong creams, fine creams, that we should discourage. People should not do that. They should take a proper consultation, and healthy lifestyle, walking, proper hydration is also important, and consumption of a good healthy diet, which will take care of the skin. It's all, we want a healthy skin, not a very fair skin.
Right. So it's important to have told you to. Thank you so very much, doctor. It was really a pleasure to have you, and we really look forward to having few more sessions with you on various topics for our viewers. Thank you so very much, Dr. Nazia Nousheen, for your valuable time. It has been very informative session for our viewers, and it was great to hear you. We really look forward for many such sessions. And stay connected to our beautiful Spotless Skin page. Thank you. Goodbye.
Thank you so much for this.
Like, subscribe, and press the bell icon. Thanks for watching.